Assalamualaikum and good day everyone. Today, my group will present a topic which is toxicology of kidney or what we call nephrotoxicity. Our group consists of 8 persons including me, Nur Ain binti Abdul Isham. Before I jump to our main topic, I would like to give a short review on what will be discussed today. So, this is our subtopic and I will explain about what is nephrotoxicity. Nephrotoxicity may also be referred as renal toxicity. Nephrotoxicity is one of the most common kidney problems and occur when your body is exposed to a drug or toxin that cause damage to your kidney. When kidney damage occur, you are unable to get rid of excess urine and waste. Your blood electrolytes such as potassium and magnesium will be elevated. So how can we diagnose the patient have nephrotoxicity? There are 2 laboratory tests that will show does an individual having the disease or not. The first test is blood urea nitrogen, BUN, is used to determine if there is extra nitrogen waste in your bloodstream, which should have been filtered out of your kidney. One of the symptoms of kidney problem is the failure to filter as much urea as is necessary. An excess of nitrogen compound in the blood may lead to uremia. And the second test is creatinine. The serum creatinine is present after the chemical creatine is broken down by the body in order to make energy for your muscle. The kidney are normally able to filter out large amount of creatinine on a daily basis. However, when kidney problems are present, your creatinine level will increase, reflecting less creatinine being filtered out through the kidney. There are many causes of elevated BUN and creatinine level. What is it? So, I would like to pass this presentation to the next presenter to elaborate more about this topic. Thank you.
Thank you for the previous presenter. Now I'm about to explain the definitions of antibiotics and heavy metals. First, we go to the antibiotics. Antibiotics is mainly used to treat bacterial infections, and it is made of microorganisms that selectively inhibits the growth or kills the microorganism. What leads to toxicity when overuse or expired antibiotics is being used? Okay, next. Heavy metals. Heavy metals is a substance that have high electrical conductivity, malleability, which means it has the capability of being shaped or extended by hammering, forging, and etc. And luster. Luster means it has a soft glow or sheen material, like it's kind of like shiny a bit, and it is found naturally in the earth crust, and their compositions varies among different localities, resulting in spatial variations of surrounding concentrations. Metals distribution in atmosphere is monitored by the properties of the metal itself and environmental factors. When in low concentration, these metals are quintessential to maintain various biochemical and physiological functions in living organisms, but it can lead to danger. It can be dangerous if it exceeds certain threshold concentration, and it could lead to toxicity. Okay, that's all from me. I will pass to the next presenter. Thank you.
My name is Putri Kota Aini binti Mama Itauden, and I will present to you guys about the specific nephrotoxicants. It is consists of the heavy metals chemically induced alpha thyroglobulin nephropathy, halogenated hydrocarbons, mycotoxin, and the therapeutic agents. Heavy metals consist of the mercury and the cadmium. Mercury is rapidly oxidized in erythrocytes or tissues to inorganic mercury, and the primary target organs is the kidney, while the cadmium is the primarily true from food and also from the workplace that contain the dust and the fumes, and the cadmium produce proximal tubule dysfunction. The next one is chemically induced alpha thyroglobulin nephropathy. This more on the male rates, because we humans are not at risk, because humans do not synthesize the size of alpha to euglobulin. One is the halogenated hydrocarbons that consist of the chloroform, tetrafluoroethylene, and the bromobenzene. This substance can expose to the humans in the workplace and in the environment. Next one is mycotoxins or fungi. For example, is fumonisins B1 and B2 by the corn products and aristolochic acids. Lastly is the therapeutic agents that consists of the acetaminophen and SAID drugs, aminoglycosides, amphotericin B, cyclosporine, and cisplatin. I think that's all from me, and I will pass to the next presenter. Thank you.
Next is the mechanism of heavy metals. So heavy metal can cause oxidative stress. Oxidative stress is caused by the imbalance of pro-oxidants and antioxidants in our body. So how does this happen? The imbalance of pro-oxidants and antioxidants are caused by free radicals productions from heavy metals. It can disturb the metabolism, which can cause permanent damage in structures of lipid, protein, and DNA. So what are free radicals? Free radicals are atoms that contain an pair electron. Free radical atoms are not stable due to lack of stable number of outer shell electrons. These free radical atoms will constantly search to bind with another electron to stabilize themselves. So free radical atom produced by heavy metals will be detoxified by antioxidants as a repair mechanism. For example, antioxidants such as glutathione in the cell will protect the cell from free radicals such as hydrogen peroxide or H2O2 when under the influence of heavy metals such as lead. Other than that, metals are redox active, so they can undergo redox reactions and produce reactive oxygen species, or also known as ROS. So when the level of ROS increase, it will disrupt the intracellular redox state and energy productions. This also contribute to the imbalance of pro-oxidants and cause oxidative stress. Next is the diagram. So from this diagram, we can see heavy metals such as cadmium, mercury, aluminium, iron, arsenic, lead, and chromium can cause the ROS level to increase and disrupt the defense mechanism by antioxidants, which cause oxidative stress and eventually lead to cell apoptosis.
Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Syaiwanis binti Mama Isha. I'm from Group 6 and now I'm going to present about the mechanisms of nephrotoxin drug. We have three types, amphotericin B, polymyxins, and aminoglycosides. For the first presentation, I'm going to talk about amphotericin B. Amphotericin B is a drug that causes distal tubular acidosis characterized by net acid excretion and reduced acidification of urine in response to an acid load. It also decreases glomerular filtration rate, and ischemic damage appear to be secondary to drug-mediated renal vasoconstriction. Acute amphotericin-mediated response includes an increased chloride permeability of the distal tubule, followed by the activation of the tubuloglomerular filtration. Proline macrolide antibiotic toxicity towards the eukaryotic cells is generally attributed to the membrane permeability changes resulting from proline macrolide sterol interactions. Amphotericin is slowly excreted and has a half-life of 24 hours. Acute effect of amphotericin B on the distal tubule is a reflection of a rapid permeability change to chloride ion. For the second presentation, I'm going to talk about the polymycins. Polymycin bind to the cellular component of the kidney, and polymycin B accumulate intracellularly to the high levels in the kidney. The degree of the tissue binding, nephrotoxicity, inhibitory action on the proximal tubular purate transport, and antibacterial activity are directly used to the number of free amino groups in the antibiotics. A balance between the protonated and unprotonated amino groups in the molecule is important in both antibacterial and nephrotoxic effects. Proximal tubular damage by polymycins may result from the relatively selective accumulation in the cells of the proximal tubules. For the third presentation, I'm going to talk about the aminoglycosides. For aminoglycosides, it can induce both structural and functional kidney damage. Aminoglycosides are not metabolized to the significant extent, and the major route of excretion is by the glomerular filtration. The toxic effects of all aminoglycosides are known to be both dose and duration dependent. In addition to being concentrated in the renal cortex, this antibiotic also retain this in chemically unmodified form for an extended period of time. Furthermore, there is a major and directly proportional dependence on the renal plasma flow rate. Reduction of the hydrostatic pressure difference across the capillary wall has an important effect. An increase in plasma protein concentration leading to elevated plasma oncotic pressure will decrease filtration route. Finally, reduction capillary water permeability and or effective surface area in the glomerulus will reduce the glomerular filtration. That's all from me for the mechanisms of the nephrotic antibiotic. Thank you.
Assalamualaikum warahmatullahi wabarakatuh to Dr. Arniwati and my fellow friends. I am Damia binti Zaman Nizam. So today I would like to present to you guys about the signs and symptoms because of the effect of toxicant in nephrotoxicity. So as we all know, nephrotoxicity is a rapid deterioration of kidney function that can cause kidney damage due to the toxin effect of medication and chemicals. So basically, when our kidney is damaged, our body are unable to get rid of the excess urine and waste product. So this is a very harmful and not good for our body. So let's see the sign and the effects of toxicant cause to our body. I have two examples here, heavy metal and antibiotics. For heavy metals, it can be divided into two types of exposure. One is acute exposure and second is chronic exposure. Okay, for acute exposure, the sign and symptom is feel confused, feel numb, muscle weaknesses, hyperkalemia, abnormal pain with vomiting and nausea. Okay, for hyperkalemia is a condition where the level of potassium is very high in your blood. Okay, for chronic exposure, the sign and symptom is headache, fatigue, constipation, myalgia, anorexia, and non-specific abdominal pain. For myalgia is actually a medical term that is used for muscle pain. So next, sign and symptom for antibiotics. Usually, sign and symptom for antibiotics often occur within an hour after taking the drug. So, you may have skin rashes, itching, hives, fever, swelling, wheezing, anaphylaxis, or shortness of breath. So next is the disease that related to nephrotoxicity, that are chronic kidney disease, acute kidney injury, glomerular nephritis, tubular lesion, and cancer. And other diseases also may include black foot disease, Parkinson disease, and gout. That's all from me. Thank you. I would like to pass to the next presenter.
Hello everyone, my name is Nur Aisha binti Anwar. So today I will share about the treatment of nephrotoxicity. The treatment consists of two, which is heavy metals and therapeutic agents. First of all, bile dimercaprol is used to remove intracellular and extracellular lead. It is a lipid-soluble drug and must be administered intramuscular only because IV may cause fat embolism. Next, we move to calcium disodium edetate. These drugs allow extracellular lead to be renally eliminated. Once started, this drug should be given in 5-day courses. The first dose begins removing lead from extracellular fluid in bone. If not followed by the next doses, it will lead to neurotoxicity. In case of lead encephalopathy, dimercaprol or bile should be given first to avoid redistribution of lead mobilized by calcium disodium edetate to central nervous system. Next is D-penicillamine used orally and may cause few adverse effects. These drugs can chelate lead even in low blood levels. It is effective in children with level 20 to 40 microgram per 100 ml. Next is the treatment of using therapeutic agents, which my friend Kurotu already mentioned as therapeutic agent is part of specific nephrotoxicants. Generally, drugs-induced renal impairment is reversible by providing the nephrotoxicity earlier recognition. So, the nephrotoxicity by therapeutic agents were induced by drugs itself by controlling the doses. Without the correct amount of doses, the drugs can lead to neurotoxicity. That is all from me. Thank you. I'll pass to the next presenter.
Assalamualaikum and hi, my name is Nurusna binti Yusaini and I will present about how to prevent nephrotoxicity. Number 1, wear mask and protective clothing if you work around heavy metals and ensure that your workplaces follows OSHA guidelines. Depending on your workplace safety level, this is an example of protective clothing that you need to wear during work time. Number 2, limit your consumption of fish known to contain higher level of mercury, such as shark, ray, swordfish, barramundi, orange roughy, ling, and southern bluefin tuna. Number 3, have your home tested for lead if it was built before 1978. Number 4, only purchase supplements and spices from trusted and high quality sources. Number 5, use alternative non-nephrotoxic drugs. Number 6, assess baseline renal function before initiation of therapy. Number 7, consume the right dosage of drugs. Number 8, monitor renal function and vital signs during therapy. And number 9, avoid nephrotoxic drug combination.